This is the Pet Buzz. And here's the dynamic pet duo.
Dr. Bellows, welcome back to the Pet Buzz.
Great to be here.
So, Dr. Bellows, studies have even shown that sonic toothbrushes provide superior plaque removal. These toothbrushes are pricing out from $99 to $200. Is an ultrasonic toothbrush for a pet worth the splurge?
Yes and no. The science behind it is great. I use it myself because the bacteria is kind of eliminated by what they call acoustic streaming rather than just wiping it away. So it's a cool process. The problem is that the dog or cat will be fearful of the experience. And we're very much into fear-free and not cause anxiety. They would be afraid of the brush. So it would take a lot of getting used to. And if you have a puppy or a kitten, sure, start it from the beginning and give them a treat that related to the brushing so they can have the experience. But sure, it'd be great, but not to start it on an older animal.
Okay, so basically you can go for the gusto, you can spend the bucks, but the most important thing is to train your dog to get used to it, right?
And most important is to do something every day to control plaque.
Okay, that's the key, every day.
Every
Okay,
day.
so it's been said that pet dental toys have two key functions. Firstly, the toys encourage your pet to chew. Supposedly, the chewing action is said to stimulate a dog or cat's body to produce additional saliva, which can then again rinse away the food debris and bacteria. And secondly, the chewing action is supposed to clean the pet's teeth, removing plaque and tartar. Is this true? And should I spend anywhere from $3.99 to about $20 on pet dental toys?
It is kind of true. The
the
reason why it's kind of true is the philosophy is correct. Mm-hmm. The problem is that the products, in most cases, are not evaluated. So you could put anything you want on a package. Mm-hmm. Freshens breath, cleans teeth, whitens teeth, not made with any GMOs. I mean, what people are looking for. But there's only one organization, the Veterinary Oral Health Council, vohc.org, that evaluates dental products for efficacy, vohc.org. And this is a nonprofit organization made up of veterinary dentists that volunteer for their role there. And they make sure that the products that are accepted will decrease plaque and or tartar by at least 20%. And some of them decrease it by 50 and 60 and 70%.
Okay, so we have to look for VOCHA?
No, VOHC, Veterinary Oral Health Council.
Okay, we got that.
.org.
That's great advice. Okay, sure. Next question. When it comes to anesthesia-free cleaning, which ranges from about $100 to $300 at the groomer, is it worth the money?
No.
Okay, why?
And the main reason is because they're taking off, and they're very good. The folks that many of the folks that do it, but they take off the plaque and tartar from the crown of the tooth, and that's not where the disease is. The disease is below the gum line. So what you need to do is get a curette below the gum line, and that's done under general anesthesia, so the pet doesn't feel it at all. Plus, it's impossible to take dental x-rays, which shows what's going on below the gum line. In people, most of the teeth you see, and there's very little roots because people don't have to go out in the field and kill squirrels and rabbits to eat. Animals have very long roots because the teeth are sunk into the bone very, very securely, so they can go out and fend for themselves. And this is where the disease is. And none of that can be treated through what they call the dental groomers.
Okay, so don't spend the money on that fast action scraping.
Well, it's so important that you mention this because many of our clients are concerned about general anesthetic, of course.
And they should be. And what they should do is have a talk with their veterinarian and anesthesia can be performed safely if you choose the right patient. So the patient has to be evaluated by blood test and exam. And then you choose the right anesthetic protocol. The anesthetic agents that we use now are just so safe. And then, very important, that they're monitored both through the procedure and especially right after the procedure. Most adverse events happen right after the procedure. So it's real important that don't just drop your dog or cat off. Speak to the veterinarian and make sure that the veterinarian knows that you are very concerned with anesthesia, and it's so rare. It's like one pet in 1,000 has a problem.
Wow.
So it's rare that bad things happen.
That has a problem, but not even that many have a serious problem.
Right. Very few die.
Okay, so we hear that a quality probiotic supplement can help transform our health. In the case of pets' dental health, it is true that pet dental probiotics are meant to work on dental and breath issues from the inside out by strengthening your pet's resistance to the effects of oral bacteria, including bad gums, bad teeth, and bad breath. So, should a dog and cat owner spend about $20 on a pet dental probiotic?
Maybe.
Dr. Fauci.
Maybe.
Fauci.
And, and I only deal, like Dr. Fauci, with science. And there may be some promise in this. What they found is that by changing what they call the oral biome, they can change the volatile sulfur compounds, which is what you smell as bad breath. But that doesn't do anything to the pockets. The big problem with animals is no one brushes their pet's teeth. And so plaque and tartar build up and pockets form. And then the food that they eat every day just sits in the pockets. And you can imagine if you put breakfast in your pocket and just left it there for 6 months, your leg would rot off. So the probiotics will change some of the bacteria so they smell better, but it doesn't address the cause of the malodor, which is the pockets. And that's why you have to see your veterinarian at least twice a year to at least have it evaluated. It doesn't mean that they have to be placed under anesthesia twice a year, but they should be examined twice a year and do something every day to control the plaque and tartar. And in my practice, what I recommend is daily wipes.
Dr. Bellows, he looks a little like Dr. Fauci. And wait,
I think my wife would like that. If I'm 80 years old and look that much like Dr. Fauci, I'd be.
I mean, you could, right. And they're both from New York.
Yeah.
They both have the glasses.
Yeah.
He just has a squirrel on his neck and he's not wearing the white coat.
Yeah. Well, all of us over 40 have glasses. So go on.
But, I think, but here's the thing, like Jan looks so happy now, but I think Dr. Fauci is now happier than he was a few months ago. Okay. We won't even get into that. So let's trump along with the next question. Okay. Is it worth the money to buy dental gels, sprays, and water additives? And they cost anywhere from, I guess, $6.95 to get this $41.95. That's a lot of doggy bones. It's a lot of bucks.
The answer is yes, if there's research behind the product. And the products on the veterinaryoralhealthcouncil.org, VOHC, are products that have been shown to at least decrease plaque and or tartar by 20%. Most of them do a lot more than that. So it is definitely worth it because periodontal disease is painful. Bad breath comes from pockets that get worse. It's progressive. There are 4 stages of periodontal disease. And if you do nothing, they go from 1 to 4, and then the teeth get mobile, which is even more painful, and eventually fall out, or the veterinarian has to take them out. So right from the beginning, start with preventative care.
Dr. Fleck, did you notice how he really wanted to give that maybe answer, but then he covered himself?
Dr. Fauci.
I mean, I know. So you had one last question before we wrap it up with Dr.
This
Jan.
is what our listeners really want to hear. What's the best way to take care of our pets' teeth?
The best way is to daily wipe the teeth. And your veterinarian or online, You can get wipes. I like the ones that look like handkerchiefs. They're put out by Dectra, Dechra. It's called Vetrident. And it's not so important what is in the wipe. It's the actual friction and the fact that you can throw them away every day. In cats, the best thing is a Q-tip dipped in tuna water that is rubbed against the gum surface. The tuna water doesn't do anything medically, but cats seem to like it. But the key is that plaque builds every day. That's why you brush your teeth twice a day. And at least once a day, twice would be better, attack your pet's plaque.
Wonderful.
Great
answer.
advice.
Absolutely.
Simple. And that doesn't, wipes don't cost a lot of money.
No.
No, not
they
at all.
really don't. And you get to throw them away. It's not like the finger brush or the brush, because it's kind of like the bowl. A lot of times people don't wash the bowl or wash the brush.
So just to reiterate, that's a dental wipe, or is that just a wipe?
Dental wipe.
Dental wipe.
Dental wipe. And stay away from hard bones or antlers or bully sticks or anything that doesn't significantly bend, because that breaks dogs' teeth.
That was
Stay
your
away.
emphasis last year. Absolutely.
Yeah.
For good
Great.
reason.
Hey, Dr. Bellows, thank you so much for joining us. What a great interview.
Thank you.
Thank you for listening to this episode of The Pet Buzz.